Homeopathic Clinics Session 2. In the second session, we are going to discuss fever, a common condition encountered in our day-to-day practice. Fever, as you know, is one of the symptoms of the underlying disease process. By and large, the causative factor is an infection, maybe bacterial or viral. Now let us review the pathogenesis of fever as we know today. When infective agent enters into the body, pathogenic cytokines are produced in the body. These in turn stimulate production of prostaglandins E2 by hypothalamus, which activates cyclic AMP, and that raises the set point of thermoregulatory center in the hypothalamus. This gives rise to increased body temperature. We name it as fever. Besides, microbial toxin can directly stimulate hypothalamus, leading to production of prostaglandin E2. Prostaglandin E2 is also responsible for body ache, joint pains, etc., commonly observed in fever. In first 2-3 days, such vague symptoms are there and the diagnosis of fever may not be possible. In homeopathy, it is possible to treat such cases by detailed history and symptomatic indications for a specific drug. This may avert the future course of disease. Let us find out the therapeutic approach to fever in homeopathy as against allopathy. In allopathic practice, earlier 2-3 days, fever is managed by antipyretics. These act by inhibiting synthesis of prostaglandin. If necessary, antibiotics are given. Homeopathic drugs appear to boost immunity, producing sufficient antibody response to do away with infection. In homeopathy, we do not find immediate decrease in fever. We have to remember that fever is a natural response of the body to infection. It helps in containing the infection. Therefore, with homeopathic treatment, disappearance of infection and fever occur simultaneously. We have to explain this to our patient to avoid the worry and panic. Now let us consider a group of drugs which come very often in the initial stages of fever. Pulsatilla, chamomilla, nux vomica, arsenicum album, rasta, heparsal, bryonia, gelsemium, sepia, eupatorium perfoliatum, and sulfur. Now let us reflect on some of the common presentations of these various drugs. Take example of pulsatilla. Mildness characterizes pulsatilla pathogenesis. Patient may have mild gastric symptoms like vomiting or loose motion, or he may have little cold, cough. But along with mildness, what characterizes pulsatilla is the type of crying. The child is not crying, child is moaning. Now that is pulsatilla child. As against this, if you see chamomilla, it is just opposite. Chamomilla again may have loose motions, may have what you call it, the greenish diarrhea, may have cold and cough. But what characterizes chamomilla against pulsatilla is the type of crying. Child is irritable, wants to be carried and crying all the time. The mother may come down with, because she is sleepless, mother may come down with that, okay my child, now you doctor, you do something. Now this is chamomilla. Now we come to the third remedy, nux vomica. As you know, gastric concomitants are most common in nux vomica pathogenesis. Nux vomica also acts as sphincter. So the child, suppose if he has vomiting sensation, he may be unable to vomit and then he may do that sort of action. Suppose if he has desire to pass stool, he is unable to pass stool, he just presses, a little stool may come out and again his little, for a while is little better, again the phenomena start, that nux vomica. Nux vomica also may have a little cold, nose block, nux vomica is irritable, nux vomica also, the child also cries, and that's what nux vomica presentation. Another remedy commonly coming is arsenicum album. What characterizes arsenicum album as against all these drugs is the evolution of the symptoms. It's very fast. The mother will tell you the child has started vomiting, he has loose motion, he vomits immediately after taking something. Along with that, the vomiting or loose motions may have offensive odor. Another characteristic of arsenic, the child is restless, the child cries. Now you have observed that in all these remedies, crying is very common, as we always get with children, but it is different in all these drugs. Observant mother will tell you that suppose if the data is not coming, you can inquire, you observe and try to differentiate the remedy. Now come to another remedy, rust tox. Again, rust tox may have gastric concomitant like little 2-3 motion, he may have little vomiting, but what characterizes rust tox is restlessness, and if you get characteristic coating on the tongue, you know the whole tongue is coated but the tip of the tongue is red. Now that clinches rust tox diagnosis. Heparsal is one more remedy. Heparsal, the action is more on respiratory tract, as you know. He may have cold, he may have little cough. But what characterizes heparsal is he is sensitive. He is sensitive to touch, he is sensitive to light, he is sensitive to noise. Now you will ask me, how will you find out how the cry? The child may not tell you that. See, the observant mother will tell you that when the child is not covered, she is not covering the child becomes little restless. When she covers, the child is quiet. Now that shows the chilliness of heparsal. When the child is touched, he will startle. You know, the sensitivity of the child, that's how it is to be made out. These are small things which are to be observed, which are to be inquired in homeopathic practice. Now we come to bryonia. Again a different picture. Dull child. The child otherwise is active, becomes dull. Besides that, he may have constipation, he may have increased desire for water. Now how will you make out that? If the mother gives water to child, he drinks hurriedly. That's how you have to conclude that the increased desire for water. Similarly, his mouth may be dry, he may be dull, and that's what bryonia is. All these drugs you have to administer in 30 or 200 potency, but once you know the constitution of the child and sensitivity of the child, it is better to give 1 or 10 that is better result. In young children and further on, except chamomilla, all other drugs will come. But will certainly get additional symptoms because now the child is talking. He may have, say for example, pulsatile thirst, but pulsatile thirst is little different. That he will ask for small quantities of water often. Nux vomica, ineffectual desire for stool. In Rustox and Bryonia, body ache, but the Rustox will be restless, Bryonia will be quiet. Now all these things in elder age group we will get because they are able to communicate. Besides this, certain other drugs come for consideration while treating fever cases. One is gelsemia. What characterizes gelsemia? Weakness. As against all these, weakness characterizes gelsemia. The child is weak, the patient is weak, he may have drowsiness. If you look at his eyes, they are just drooping and he is drowsy. Besides that, thirstlessness, respiratory symptoms like cold and cough may be there. Now sepia is another drug. Not come very often, but when it comes, that's what the sepia, how will you diagnose sepia? Sepia may have again gastric symptoms like noxomica, like arsenic. He may have little giddiness. Sepia will have nausea, that is very characteristic. Nausea at the sight or smell of food. Along with that, suppose if you get, patient may say that he has got sort of burning or heat in the eye, and as if it is coming out of the eye. Now that clinches diagnosis of sepia. See, these are the different presentations by which we are to go in homeopathic practice. Now we will come to Eupatorium perfoliatum. What characterizes Eupatorium perfoliatum is severe body ache. It's not only body ache we get in Bryonia or Rustox. The patient will tell you as if the bones are aching and severe body ache. That characterizes Eupatorium perfoliatum. Along with that, he may have gastric symptoms, he may have vomiting, bitter vomiting, he may have cold, cough and whatnot. So now you know how exactly the diagnosis is to be made. The severity of the symptom, the combination of symptoms, that's what the totality of in homeopathic practice, and that's how we go along in treating not only fever but any case. Say for example, Rustox, Bryonia, Eupatorium, all three have body ache. Rustox and Bryonia differ because Bryonia is just quiet, he doesn't want to move, while Rustox, even with the body ache, he is very restless. If you take Eupatorium, it's the intensity of the body ache that characterizes Eupatorium. You take pulsatile and sepia, but both have thirstlessness. But along with that, it may be that you get, the patient may say that he has got severe heat in the eye, that is, the heat is coming out of the eye. That differentiates pulsatile and sepia, that clinches sepia. Now this is how we have to go in homeopathic practice. Now it may be that you give this drug, the fever has come down a bit, but again it has not settled completely. In that case, your advice, or one gets better results if you administer sulfur as an intercurrent, which may either, after administration of sulfur, you will find that the symptoms have changed for some other remedy, or the fever has just disappeared. Sulfur can be given in 1 ml, 10 potency. Now, okay, you are given the initial stages remedy, now you are given sulfur, but now it is now 3rd day, 4th day, the fever has not come down. Then we have to think of various diagnostic possibilities, and here we will go symptom wise. In the next part, we will start with respiratory symptoms.